Aldosterone blockade reduces mortality and morbidity among patients with severe heart failure. We conducted a double-blind placebo-controlled study evaluating the effect of eplerenone, a selective aldosterone blocker, on morbidity and mortality among patients with acute MI complicated by left ventricular dysfunction and heart failure. Patients were randomly assigned to eplerenone or placebo in addition to optimal medical therapy. The study continued until 1012 deaths occurred. The primary endpoints were death from any cause, death from cardiovascular causes, hospitalization for a heart failure, acute MI, stroke, or ventricular arrhythmia. During a mean follow-up of 16 months, there were 478 deaths in the eplerenone group and 554 deaths in the placebo group. Relative risk 0.85. Of these deaths, 407 in the eplerenone group and 483 in the placebo group were attributed to cardiovascular causes. The rate of the other primary endpoints, death from cardiovascular causes, hospitalization for cardiovascular event, was reduced by eplerenone, as was the secondary endpoint of death from any cause or any hospitalization. There was also a reduction in the rate of sudden death from cardiac causes. The rate of serious hypokalemia was 5.5% in the eplerenone group and 3.9% in the placebo group, whereas the rate of hypokalemia was 8.4% in the eplerenone group and 13.1% in the placebo group. Which of the following represents the relative risk reduction in all-cause mortality, the primary endpoint in the patients supplemented with eplerenone? Which of the following represents the relative risk reduction in all-cause mortality, the primary endpoint in patients supplemented with eplerenone? So, relative risk reduction is 1 minus risk reduction, 1 minus RR. So, relative risk reduction represents a clinical statistical calculation. It is 1 minus relative risk, that is 1 minus 0.85 is 0.15. Here is your answer, that is 0.851. Relative risk is of 0.85 in the eplerenone group. In the eplerenone group, the relative risk is 0.85. So what will be triple R? So it will be 1 minus RR, that is 1 minus 0.85, 0.15. So relative risk reduction or efficacy is the relative decrease in the risk of an adverse event in the exposed group compared to the unexposed group. It is computed as IU minus IE upon IU, where IU is the incidence of disease in the unexposed group and IE is the incidence of the disease in the exposed treatment group. So unexposed minus exposed upon unexposed. In question 5, why can we not calculate RR? Because RR is always given to us. Here the result is given to us during a mean follow-up of 16 months. 470 deaths in the eplerenone group and 55 deaths in the placebo group. Relative risk of 0.85, it is already given to us. Why you want to calculate? Which of the following represents the relative risk reduction in all-cause mortality? The primary endpoint in supplemented with eplerenone. The relative risk is already given to you. It is 0.85. All you need to do is to answer that what will be the relative risk reduction, which is 0.85 subtracted from 1. Yes, if it is not given, then you are supposed to calculate it, right? Yes, you're absolutely right. If you are not given, then you are supposed to calculate it. And for in that scenario, I am going to help you right now that you need to go through this page on your first aid. That page number 260 of your 2022 edition first aid, it is given. The relative risk is given. You need to make a 2 by 2 table. Relative risk is A by A plus B upon C by C plus D. And relative risk reduction, it is the proportion of risk reduction attributed to the intervention as compared to a control. So it is 1 minus RR. I hope it is clear to you now, because it was already given. We didn't have that hassle to calculate the relative risk. You have to just simply subtract it from 1. If it was not given, yes, definitely first you have to calculate the relative risk and then subtract it from 1. So you will be going to the answer. I hope it is clear to you now.
Thanks for watching. Please give a thumbs up and subscribe for more.